presentation, I'm honored to introduce Professor Amir Attaran from the University of Ottawa. Professor Attaran is trained as both a lawyer and a biologist. His current research interests include studies on the social and policy determinants of health in areas ranging from malaria to AIDS to hypertension, the fight against criminally counterfeit, falsified, and substandard medicines, the role of intellectual property in trade law, on access to medicines in less developed countries, and the application of human rights law in armed conflict and anti-terrorism. Dr. Attaran has published widely in the leading journals of both the legal and biomedical professions, and is an editorial consultant to The Lancet, and is on the editorial board of the Journal of Epidemiology and Community Health. He has also published journalism in the Globe and Mail, New York Times, The Guardian, and the Literary Review of Canada, among others. Dr. Attaran holds a law degree from the University of Vancouver and a doctorate in biology from Oxford University. Welcome, Professor Attaran.
Thanks very much. I'm speaking without slides because my points are fairly simple to make. We've talked a great deal this morning about the medicine crime problem in developing countries particularly, but I want to make this about the United States. The medicine supply in the United States today is less secure than it has been in decades, in our lifetime. We are at greater risk of substandard and potentially falsified medicines in the United States today than we have been in a very long time. And the reason for that is 80% of the medicines that go down your throat as Americans today contain products or ingredients made abroad. 80% of our medicines are imported from countries that don't adequately regulate those medicines. And I'll just give you a few examples. You might remember that in 2008, about 80 people died because of heparin, close enough, that was falsified. That heparin came from China. It was an outright fake. Nobody has been prosecuted. Nobody has been brought to justice. In 2012, Ranbaxy, an Indian pharmaceutical company, shipped into the United States a heart drug called atorvastatin containing broken glass beads inside. They were forced to recall the medicine. Now, subsequently, it emerged that Ranbaxy had falsified the data for many of its medicines. Basically, it got regulatory approval from the U.S. Food and Drug Administration through fraud by faking the safety data. It pleaded guilty to that criminal offense in the United States. It paid criminal fines and penalties of $500 million. And you know what? This is an Indian company. It's never been prosecuted in India. So the maker of that fake heparin in China, off the hook in China. Ranbaxy selling adulterated medicines in the United States, off the hook in India. This is the problem. We are now increasingly dependent on foreign countries that do not regulate drugs the way we want them regulated. And so, if we want to stop medicine crime, and I think we must, for all the reasons that my co-presenters today have said, let us be clear about this. The very first step that needs to be taken after the research is to translate this into policy and into law. Because you cannot expect to put medicine criminals behind bars where it's not a crime, or it's not treated as that. If murder were legal, how would we stop people killing one another in the streets? So the fundamental issue here is law reform. And I say that because countries, for the most part, have very weak laws. I don't want to pick on India and China alone, although their failures are enormous. My own country where I live and work now, Canada, do you know what the penalty is for adulterating a medicine? 2 years in prison at most. 2 years. Just 2 years. And I've never seen anyone go to prison for 2 minutes. Much less 2 years. In the Netherlands, those forward-thinking Dutch, their laws stipulate no imprisonment at all, none, for adulterating a medicine, unless you get caught twice. The first time you get a free pass. Now these are supposedly so-called advanced countries. I would say they're really pretty backwards. But when that's the case with the law in the advanced countries, you can only imagine what it's like in the developing countries. And to change this scenario, we are in need, and I think all my colleagues will agree, we are in need of taking the outstanding science that has been done in this area and translating it into law so that there is really appropriate criminalization of the perpetrators, the organized criminals who are faking medicines. This is organized crime. And by the way, it's a great organized crime to be in, because if you get caught with, say, narcotic drugs, cocaine, heroin, as I mentioned earlier, you'll go to jail for a very long time. That's a hard way to make money if you're a criminal, because you run a lot of risks. You make fake medicines, there's almost no penalty. What a great crime to be in. And so we've unwittingly set up our law around the world to make these criminals able to prey on us and our children and our families. That's the problem. So I will recommend, and I'll end very shortly, please have a look at one of the papers which I've written in the special supplement of the American Journal of Tropical Medicine and Hygiene. This is a model law on how to criminalize fake medicines. It's a one-size-fits-all law that any country in the world can freely use to try and address this problem and appropriately criminalize the organized criminals who are threatening our health. That's a model law that is not covered by a copyright. It's free to use. Anyone can use it under the license that is provided in the journal. So have a look. It's also published on the Social Sciences Research Network. You can download a copy for free. Thank you.